Hello and welcome to Making the Cut, the podcast dedicated to everything plastic surgery, health, and wellness. I'm your host, Dr. Patrick Basile, board-certified plastic surgeon from Jacksonville Beach, Florida, and I am joined by my awesome co-host, the amazing and talented nurse practitioner, Hope Gulley.
Woohoo!
All right.
How are we on episode 6 already?
I don't know, but it's fun.
It's crazy. It's fun.
And
we're
great
having a blast. Yes. Yeah.
And you know, the nice thing is the feedback we're getting is stuff people want to listen to.
Right. It's given us a lot of ideas. So all feedback is welcome. We want it. It's amazing. Gives us some fun things to talk about. So.
Absolutely. So we've gone through sort of learning who we are, what our consults are, what one of our most common surgeries is. Today, we're going to kind of dive into part of the journey of surgery, and we're going to call this scarring, swelling, and recovery. What is actually normal?
Right.
Because I think that's, people rely on Instagram, TikTok, Snapchat for thinking what is normal or getting their info from, and a lot of it is incorrect.
Right. And I think it's important to walk through because when we're talking recovery, like you said, when we look at social media, we're looking at months down the line, before and afters. And we want to talk about that in between, kind of that part that isn't really talked about too much too.
Totally. And I think it starts with education, which for sure we are very passionate about.
Definitely. I think if you don't have an educated patient, then you're just kind of signing up for a pretty tough recovery for both you and the patient. It's the best way to go, always.
So, Hope, during one of the consultation parts we talked about, we didn't get to the pre-op, which at that time is really where we're going to be talking about our realistic expectations. So talk a little bit about that, about the journey.
Sure. Yeah. So our pre-op appointments and how we do it here at the practice is you meet with one of our clinical team members, whether it's myself, our nurse Madeline, really anyone on the clinical team. But what we do is we walk you through everything from what supplements can you take or not take before surgery? What does recovery look like to you? And that's per surgery. So every surgery does have a little bit of a different recovery. There's kind of a similar tune to each thing that we do. But we do go through like incision patterns and, your medications and everything that you need to know. But it's not just about the day of surgery and the week after. It's the months after. And that's something that we go through both during your preoperative appointment with us, but also every single post-op that you have within those first couple weeks, because it's easy to forget.
Oh, yeah. And again, despite all that, thorough, going through everything, we still encounter patients feeling or, that things might not be normal.
Right.
And that's fine. We're expecting that. We do this every day, all day. So it's kind of normal to us, which would seem abnormal. But again, I think when people go on social media and then they see people either the next day, being like, hey, everything's great.
Yes.
There might not be a lot of truth to that. So a lot of what we do is work with the expectations, but also one of the most important things is we keep close touch with our patients, right?
We do.
So
a lot of communication.
Yeah. So day of surgery, I call the patients at night. Next day, you call them if we don't see them.
Right.
But we almost always see them the next day or the day after that. But talk to me a little bit about that post-op day 3 blues or regret.
Very common.
Where
Yeah. So it's a lot of that, when I typically, how we work is I'll see you the day after surgery where we take all your garments off for the first time. And, we're like, oh my gosh, this is amazing. This looks so good. And then swelling kicks in. And then that's when the discomfort really kicks in is day 2 to 3 I found. And so that's when we get the calls of hey, this feels different. This looks different than when I saw you. And, it's a really emotional journey, which I think isn't really talked about as much, or it's kind of glazed over in a way, or patients just don't have contact with their practices the way that we do. So we get a lot of that feedback and get to walk you through that emotional journey too, which I think is important.
And it's also helpful to when the significant others or the people taking care of it are part of the process.
The whole process.
That's really important because they're like, hey, remember when Dr. Basile or Hope said this is what it's going to be like, and they remind them.
Yeah, and I'm very pro patients taking notes during our appointments, or even if they're hey, I just need to turn the video on and just record what you're saying because I'm not going to recall. I'm all about it because that's what we're here for. Is we want you to feel you know, we need that assurance, even like whether you're a patient or not. We all need reassurance in our lives, and that's what we're here for.
Absolutely. Absolutely.
Always.
So yeah, checking through those tough days. And, the nice thing is like today we had clinic day and we saw a lot of 1-monthers.
Yes.
And the funny thing was like, I'd be like, how's it going? They're like, really good now.
Yes.
So it's nice when I get to see them,
Right.
which is on their 1 month.
We get them to you.
Yeah, that it's, that sucked. But like, some of the things that, we talk about are what to expect with drains.
Yep.
Or, even the things that, we don't really expect but can come up.
Yeah.
It's good to have that communication and things like that, because
Absolutely.
Also it's like, when am I going to look normal again? When am I
Yes.
going to feel normal
Yes.
again?
Yeah. And knowing that surgery in and of itself, but especially plastics, it's not an instant gratification. It is and it isn't, almost, where we get an immediate result, but then there's that recovery time where you're not going to feel like there's that kind of, almost like, to touch on like the imposter syndrome kind of ish too, of like, it's me, but it's not me, and having to wait for kind of the brain to catch up to the body, which is usually around that month.
Particularly with whether we're doing some facial surgery,
Yes.
or our patients who have post weight loss body contouring.
Absolutely.
With those patients, we particularly see like that it's not registering.
Yes.
It's like they still feel or see like they used to look. And that's just all part of it. So we kind of have to walk them through that. But really, we see the patients right at the end of surgery, and then kind of the swelling kicks in.
Yeah. And the swelling is no joke.
It's no joke.
Yeah.
And especially like when we do, like you did a laser case the other day.
Right.
Right afterwards, they look quasi-normal. And then the next day, they literally look like a burn victim.
Completely
Because that's
different.
exactly what you did.
Yeah,
you
exactly.
created, a partial thickness burn.
Right.
And so that, when you first see it, it's very striking.
It is alarming. Yeah, totally.
'Cause
Where
it's like,
you get the like panic of patients,
what happened. So what does help though is like when you show them that journey ahead of time.
Yes.
But again, even though you show them,
Yeah.
they're still like,
Once
my
it's
God.
like real, and I always tell patients, like, whether it's laser, aesthetics, surgery, whatever, is like, we're going to go over this now, but we're going to go over this in real time too. Cause that's when you're going to be like, oh, I get what swelling's like now.
Yeah. And I think the quote we use a lot is trust the process.
Trust the process.
And don't look in the mirror. In fact, I tell
Yes.
patients sometimes,
Like, stop.
looking in the mirror.
Totally.
Real results take time,
Yeah.
but they're worth it. But again, it's like, we're here to take you through the journey. And, again, I think initially when patients, we do the reveal, sometimes it's quite striking and it really does look amazing.
Phenomenal.
But a lot of times there's some swelling, bruising.
Yes.
Things just don't look right. And we know that's normal. So
Yeah.
getting them through that,
Yeah. And letting everything just like settle and soften. And that's like, especially I think that's a big talk that we have with scarring too, where it's
let's
just,
get into scars.
Yeah,
Because
let's
I think
dive in.
that's really important.
That's a
because
great part.
We'll get some patients that come in from other practices, like who just had surgery, and they're like, I messed up, my scars look terrible. So
Yeah.
tell
Or
us
I'm
a little bit
botched.
about like what we tell patients.
Yeah, when it comes to scarring, scars are unique. They're like an ever evolving kind of beast in a way. But what I've learned a lot of is time and scars go very well together. So what that means is when you have your initial scar, obviously at first, I tell every like patient when we get your steri strips off, like it should look a little lumpy bumpy. We use absorbable sutures, and as your body resorbs those, we soften and smooth out. But typical scars are going to be like pretty like almost like thick, sensitive, red, pink, your first like 8 weeks or so. So the worst they should look is your first 2 months, which is when you're really like eyeballing them the most, I would say.
Yeah.
That's when we're really fixated. But that's when we initiate the medical grade scar cream. There's laser treatments and things like that. But scars remodel up to a year and then some. So, and it's also, we need to talk about, which is what we do in our consults. Like you said, we had clinic day today, and almost everyone, we were like, show us like scars you've had in the past. Like, how do you scar? Because that gives us great intel for like how we expect you to scar with us too.
Absolutely. I mean, that's, again, one of the most important things. And then, there are certain skin types that we expect to heal better than others.
Right. Like what?
Like we call it Fitzpatrick staging, right? So like 1 through 6, and that's based on the amount of melanin in your skin. Traditionally, someone who's lighter skin, fair skin, lighter eyes should heal better. Not always the case though, because again, genetically, even though we might look very fair skin, we might have something in our genetic DNA that doesn't really allow us to heal well.
Right.
And then again, people who are darker, like myself, have a little bit more melanin, traditionally don't necessarily heal as well, but a lot of times they do. So having that prior surgery does help. But having a good history of, do you have keloiding, which is people think is the same thing as hypertrophic scarring, but it's not. And in fact, histologically, if you look under a microscope, they're very different and they have a very different etiology.
Can you explain like the difference between like a hyperpigment, like what it would look
Sure.
like? Because we have people that come in every day who are like, I keloid, and you actually don't. Yeah.
So kind of the definition, aside from the histology of it, is a hypertrophic scar or a thickened scar is going to be something that is maintained within the original borders of the scar. So it might be a little raised, might be a little thickened, different colors, stuff like that. And that has a very different etiology behind it. It could be from, it could just be because that's how the patient heals, but it could be from tension. It could be even from some bacteria or something like that.
Right.
So, but keloiding, and I think we've all seen it, but we don't necessarily, keloiding is when those wounds or those scars thicken so much that they go beyond the boundaries of the scar.
Right.
They thicken up and almost heap over. We see this a lot, again, in patients who have darker skin, who can get it from piercings, midline scars, or any
if you
type
like
of
nick when
scars.
you shave, and it's like an exaggeration.
And if it starts with a little nick and then grows into something that's all over the face, that's a keloid. And those are very, very hard to treat. Now, you can treat keloids by trying to do an excision and reclosure, using some different types of steroids as well. There also, people have done radiation actually to handle their keloids, especially if they get to the point where they're limiting the mobility of the face and everything from a burn or something like that. Hypertrophic scarring, again, a lot of times that could just be the way someone heals, but many times we see that we can make those scars look better by excising them and putting some steroid in now that they're not under tension. But some of the other ways we know to heal scars or make them look better is through laser treatment or light treatment that can get at helping remove some of the pigment, or the lasers helping kind of poke those microscopic holes in them. And then there's really neat things now of people using different types of medication in addition to those to help that. Because basically, as we heal these wounds, what the body's doing, it's part of the inflammatory response, is it's laying down all this collagen, which is the building block of our bodies and of scars. And it's not kind of in a haphazard way. They just want to get our body just wants to get that wound healed. And then what will happen is it'll start to remodel. And it'll remodel even up to a year, and sometimes even beyond that. I mean, we've seen some scars where we're like, oh, we'll see you in a year, and a patient will actually show up like 18 months later, and the scars will look amazing.
Like phenomenal,
And someone who we thought we might have to do a scar revision on ends up not needing it.
Exactly. Yeah, the body's an amazing thing. And I'm a huge fan of, especially with scarring. Same with swelling. We have kind of a similar talk track as far as like giving it time, because the body needs time. It's trying to reacclimate and trying to kind of figure out like what the heck just happened to me, Yeah.
And again, like why, I mentioned that, we get people in from other doctors and they say, oh, I got messed up, I got botched. And, there's a difference between bad surgery and then healing that, just is going to happen. Because we have patients like, listen, I tell patients all the time, I close everybody the same exact way.
Same.
I have some patients where you can't even see the scar, some patients where it's a thin line, and some patients where it gets thick hypertrophic scarring. Sometimes you can predict it like we talked about, and other times you can't. And so, again, when they come in, I'm pretty fair and honest. I said, I don't necessarily know if this is your surgeon's fault. Again, sometimes you can spot a bad surgery, but poor healing doesn't necessarily mean someone was like botched or messed up. But there are definitely ways that we can handle those scars, which we do in a lot of scar management.
I think we have a really good like scar management protocol too. But again, that's where it comes into education as well, is we'll kind of jump on things early, and we set up like, I think we're great with follow-ups too. Like we see you very frequently, especially if we're watching your scars and stuff too.
I just think that's important because, again, this is something that we see every day, but other people don't.
Yes, exactly.
So very important, trust the process.
Yes.
The timeline that we give or talk about has some variability.
Definitely.
Right? Don't look in the mirror every day.
Yes.
And then realize that, especially with bilateral surgery, one side can look completely different than the other because they are, in essence, two separate surgeries,
Yeah.
and they might have a different healing timeline.
I was gonna say definitely timelines. They're gonna be a little bit different, and that's where like you need a great team behind you, which is where like when you come in consult with someone, you need to like figure out like who's the team that's taking care of me and everything too, because you're gonna be relying on us a lot, and it's that reassurance, that constant communication.
Yeah. So again, one of the reasons why we wanted to do this episode was just, I guess, reassure people that who come in that it's going to be an emotional process.
It is.
And,
and it's a journey.
If you're one of the lucky people that have like the perfect healing, perfect thing, no problems at all, I usually say, don't tell anybody, because that's what they're going to think is the norm. And the reality is surgery is tough. Recovery is tough, depending on what we do.
Yeah.
And everybody's going to have a different journey. So, but we are there to help you walk through that process.
Definitely.
And that's really just important for us. So
definitely. Yeah.
Cool. Excellent. So one of the cool things that we didn't even talk about was that we are here in our office.
Yes.
We thought we'd change it up and go off of our main location at our studio.
Yes.
But this
bring y'all to us.
Yeah, bring you all to us. If you want to see a full tour, you can go on our Instagram and look up our Cribs episode, where I take you through MTV style how to walk through.
The best day of your life. Yeah.
But again, if you've watched or listened to our podcast, what we do at the end of every podcast and also during our clinic day to kind of get to know one another is we do a question of the day. So, what's that question?
So our question of the day today is going to be, if you had to have like a walkout song, what would it be?
A walkout song.
Yeah. Or maybe your walk into the OR song. How about that?
That's funny.
Yeah.
Because I think it's Welcome to the Jungle.
Actually, yes, it is.
I think it's Welcome to the Jungle
Totally
or
is.
Enter Sandman. But Enter Sandman, I just like the groove of Enter Sandman.
Yeah,
but it's Welcome to the Jungle.
It has to be.
Because especially like if we get a new, a student shadowing or a new nurse, and they've never seen what we're going to do, and we're about to do like a big body contour, or I'm about to take, do a facelift and take somebody's face apart.
Yes.
And it's the first time you see it, it's
pretty
striking.
crazy. It's pretty wild.
As soon as you hear that intro guitar part to Welcome to the Jungle, I said, welcome to the jungle.
Wait, that's awesome.
So what would yours be?
Normally I would say like Drake or something, he's my go-to. But I think just to honor the new Justin Bieber album, it'd probably be like Daisies from Bieber's new album. Oh, it's really good. It's a good one. Good.
I haven't had the chance to listen to it.
You have to. You got to do that after
It'll be the first thing I do when I leave here is to put on Justin Bieber and rock out.
I think that would mean the world to me.
No, I do like Justin Bieber, and I do hope the album's good. But that's, again, I haven't heard it, so I don't know. Yeah. But I imagine as soon as I put it on in the car, I'll start laughing because I'm like,
it's probably really
I got it.
Yeah. Anyway. It's really good.
Well, awesome. Cool. Well, thanks again for joining us. Yes. Again, send your requests in, comments, maybe your response to what your walkout song is.
Yes.
We like to hear that. And we will see you guys for the next episode. Thank you, Hope.
Yes. Thanks, Dr. B.
As opposed. And then, see you next time.